Now students, starting with the antimicrobial drugs. Now antimicrobial drugs is a huge chapter, and this PDF consists of around 850 MCQs based on all the antimicrobial chapters and subjects. In this we are covering general antimicrobials, general principles, then sulfonamides, fluoroquinolones, beta-lactams, tetracyclines, aminoglycosides, macrolides, then treatment of tuberculosis, leprosy, antifungal, antiviral, anti-amoebic, anti-helminthic, anti-malarial, and antiviral and antiretroviral. So let's start. I'll do little questions from each section so that you can exactly understand, and then we'll see. So choose the antimicrobial which acts by interfering with DNA function in the bacteria. The antimicrobial which acts by interfering with DNA function in the bacteria: chloramphenicol, ciprofloxacin, streptomycin, vancomycin. So DNA function के साथ तो ciprofloxacin एक्ट करता है, ये DNA gyrase को inhibit करता है, right? So this is the right answer. Which antibiotic is primarily bacteriostatic but becomes bactericidal at higher concentration? Bacteriostatic but becomes cidal is erythromycin. It is primarily bacteriocytic. Widespread and prolonged use of an antibiotic leads to emergence of drug resistant strains because antibiotics induce mutation, promote conjugation, allow resistant strains to propagate preferentially. So basically, indiscriminate, inadequate or unduly use of AMAs will result in development of resistance, and this resistance is because the basically the resistance strains, they propagate preferentially. That is the major criteria. Which mechanism is involved in the transfer of multidrug resistance among bacteria? Multidrug resistance among bacteria, the most common mechanism is conjugation. Which of the following drug combinations used to achieve synergism in treatment of Klebsiella pneumoniae infection? Now drug combination in Klebsiella pneumoniae: penicillin sulfonamide, streptomycin, tetracycline, ceftazidime, cifro, and streptomycin chloramphenicol. Now streptomycin organism synergism कब होगा? What are the fundamentals of synergism? Then that means that there has to be, it should be a cidal combination, right? Then both the drugs should be acting on different mechanisms. Same mechanism पे act करने से कोई फ़ायदा नहीं है. So penicillin sulfonamide is static, so it will reduce the speed of the reaction. Streptomycin tetracycline is static again here. Ceftazidime, ciprofloxacin से इसमें, और स्ट्रेप्टोमाइसिन क्लोराम्फेनिकॉल, इन दोनों में. सो हियर दोनों में यहाँ पे दिस स्ट्रेप्टोमाइसिन क्लोराम्फेनिकॉल इज मोर suitable because it is seen that Klebsiella pneumoniae has got low sensitivity to the cidal drug, and synergism is seen when there is a low sensitivity to cidal drug. A patient presents with symptoms of diarrhea, fever and abdominal pain. Stool test reveal presence of Clostridium difficile. So diarrhea, fever, abdominal pain, Clostridium difficile. What is the first line treatment? For initial treatment in Clostridium difficile, the drug which can be started: tetra, metro, ampi and clinda. The drug started is metro. Drug destroying type of bacterial resistance is important for following antibiotics except drug destroying type of resistance. Now drug destroying beta lactamases, they are produced usually. So that cephalosporins में वो बीटा लैक्टमेस आ जाते हैं. क्लोराम्फेनिकॉल एसिटाइल ट्रांसफरेस आ जाता है यहाँ पे, एसिटाइल ट्रांसफरेस, so that also destroys यहाँ पे बीटा लैक्टमेस. Then coliforms, they also form aminoglycoside destroying enzyme. So tetracycline is the only drug which remains in which the destroying type of resistance is not present. So this is the right answer. Indicate the sulfonamide whose sodium salt yields a nearly neutral solution which is suitable for topical use. In this, out of all the 4 sulfonamides, sulfacetamide is a sulfonamide which is having a neutral pH, and it is non-irritant and can be used in the eye. The risk of kernicterus in a patient with unconjugated hyperbilirubinemia increases with the use of ceftriaxone, phenobarbital, ampicillin, sulfonamide. It is sulfonamide. It does what? It displaces the bilirubin from the plasma protein and causes kernicterus in the neonates. Select the sulfonamide which is active against Pseudomonas, right, and is used by topical application for prophylaxis of infection in bone. Sulfadiazine, silver sulfadiazine, sulfadoxin and sulfamethoxazole. Now out of this, silver sulfadiazine is the most effective drug for the burn surfaces and is infection of Pseudomonas. Trimethoprim inhibits bacteria without affecting the mammalian cells because. Now trimethoprim does not, because what is the reason it inhibits bacteria without affecting mammalian cells? It does not penetrate mammalian cells. No, it has high affinity for bacterial, low affinity for mammalian dihydrofolate reductase. It inhibits bacterial as well as folate synthetase as well as dihydro and all of the above. So here the correct answer is this. It has got high affinity. It has got more than 50,000 times higher affinity against bacterial DHFRAs than mammalian DHFRAs. Indicate the condition in which neither trimethoprim nor sulfamethoxazole alone are effective, but the combination cotrimoxazole is. Now, alone trimethoprim sulfamethoxazole not effective, but together they are effective. So here prostatitis, lymphogranuloma, venereum, and pneumocystis, zero vecchi pneumonia, and bacilli dysentery. So the correct answer is zero vecchi pneumonia. Combined with the trimethoprim, sulfamethoxazole, it is used in zero vecchi infection, also used in nocardiosis, and this zero vecchi basically causes severe pneumonia in AIDS patient, right? Beta-lactam antibiotics include the following. They include cephalosporins, monobactams, carbapenems, so all of the above. The characteristic feature of penicillin G is unstable in aqueous solution. Its antibacterial action is unaffected by pus and tissue fluids. It is equally active against resting and multiplying bacteria. So this activity, antibacterial action, now penicillin G usually is available as a dry powder and reconstituted with sterile water at the time of injection. So one is this, and then its antibacterial action, the pus and body fluids, blood, tissue fluids, they do not interfere with the antibacterial action. So both A and B are correct. The dominant pharmacokinetic feature of penicillin G is it is equally distributed, it is rapidly secreted by proximal renal tubules, it has low oral bioavailability due to high pus, it does not cross blood CSF barrier. The pharmacokinetic characteristic of PNG is that it is rapidly secreted by the renal tubules. So this rapid renal excretion is seen, that is tubular secretion. Intradermal test for penicillin sensitivity performed by injecting following quantity of sodium benzyl penicillin, that is intradermal test के लिए हम लेते हैं 10 units, that is scratch test. So 2 to 10 units is taken. True statement about penicillin G is it is commonly administered orally, it has a broad spectrum, it can be used for treatment of rat bite fever, and concomitant probenecid decreases the duration. Now probenecid actually increases the duration, so this is wrong. Commonly administered orally, no. Penicillin G is administered by injection. It has a broad spectrum, no, it is gram positive only. So this is indicated in the treatment of rare infection like rat bite fever. This is the correct answer. Coming to tetracyclines, the most important mechanism by which tetracycline exerts antimicrobial action. Now tetracyclines, they bind to 30th ribosome and inhibit the bacterial protein synthesis. This is the answer. Tetracyclines are active against the following gram-negative bacteria. Tetracyclines are active against following gram-negative bacteria. They are active against Yersinia pestis. Sensitive gram-negative bacteria is this Yersinia pestis. Bacteria develop tetracycline resistance by following mechanisms except. So the question here is except. Losing tetracycline concentrating mechanisms, elaborating tetracycline inactivating enzymes, synthesizing a protection protein which interferes with binding of tetracycline to target site, and actively pumping out tetracycline. So here the bacteria do not elaborate tetracycline inactivating enzyme. This is an important, this is a mechanism which they don't do. Select the most potent tetracycline antibiotic. The most potent tetracycline antibiotic: demeclocycline, oxytetra, minocycline, So the answer is Mino. The following tetracycline has the potential to cause vestibular toxicity. Which tetracycline causes vestibular toxicity? Minocycline. It causes ataxia, it causes vertigo, and it causes nystagmus. Coming to aminoglycoside antibiotics, antimicrobial agents used to treat infections caused by Bacteroid fragilis are all except. So Bacteroid fragilis is an anaerobe metronidazole, rofloxacin, vancomycin, and amikacin. Amikacin is not used for the treatment of Bacteroid fragilis. This is metro can be used in anaerobic, rofloxacin can be used, vancomycin can be used. Bactericidal action of aminoglycosides is due to inhibition of bacterial protein synthesis, alteration of bacterial cell membrane permeability, damage to cell wall, inhibition of oxidative metabolism. So bactericidal action of aminoglycoside is based on the property to alter the second integrity of the cell membrane, and so sensitive bacteria become more permeable and amino acids leak out. The most important mechanism of bacterial resistance to an aminoglycoside antibiotic. Aminoglycoside antibiotic को resistance develop होता है plasmid mediated acquisition of conjugating enzyme. Which aminoglycoside antibiotic causes more hearing loss than vestibular disturbances? So the more hearing loss are caused by kanamycin. The prototype aminoglycoside commonly used clinically we use gentamicin. The anti-TB drug labeled as supplemental first-line drug is streptomycin. The first clinically useful anti-TB drug acting only on extracellular bacilli is streptomycin. Coming to the macrolides, select the antibiotic which inhibit the bacterial protein synthesis by interfering with translocation of elongating peptide chain from acceptor site back to the peptidyl site so that ribosome does not move along the mRNA and peptide chain is prematurely terminated. So here the answer is erythromycin. Erythromycin, it inhibits the bacterial synthesis by interfering with the translocation of elongating peptide chain acceptor site, and RNA and peptide chain is prematurely terminated. Erythromycin is used in patients of intestinal hypermotility because it binds to motilin receptors, and so you will see that the patient develops some gastric contractions and diarrhea kind of condition. A patient of bronchial asthma maintained on theophylline developed upper respiratory tract infection. Which antimicrobial can increase the risk of developing theophylline toxicity? So erythromycin is the drug. It basically inhibits the metabolism of theophylline, and thus it can result in toxicity. Hepatitis with cholestatic jaundice occurs most frequently as adverse reaction to following preparation of erythromycin. Hepatitis with cholestatic jaundice occurs with estolate salt of erythromycin. The drug preferred for prophylaxis of diphtheria. Prophylaxis of diphtheria is done by erythromycin. Drug of choice in pertussis is erythromycin. Drug of choice in chancroid is erythromycin. Coming to antitubercular drugs, first line and ATT drugs include following except. फर्स्ट लाइन में स्ट्रेप्टोमाइसिन होता है, पैराजिनामाइड डिथेम्बिटोल होता है, सिप्रोफ्लॉक्सासिन नहीं होता है. इट इज़ अ सेकेंड लाइन ड्रग. Which antitubercular to be avoided in a patient suffering from AIDS who is on zidovudine, lamivudine, indinavir therapy and he develops pulmonary tuberculosis? So to be avoided in a patient with HIV is rifampicin, because rifampicin is an inducer, and then it will induce the metabolism of the drug, of the HIV drugs, and then it will result in reduced effect. First line therapy of brucellosis is rifampicin. The intermittently multiplying spurter tubercle bacilli present within caseous material having low oxygen tension are more susceptible to rifampicin. It acts best on slowly intermittently dividing bacilli, or which are called as spurters. Apart from its use in tuberculosis and leprosy, rifampicin is a first-line drug for the following infective disease. Now, apart from TB and leprosy, rifampicin is also used in brucellosis. Contacts of meningococcal meningitis treated by rifampicin. So these are some questions on the tuberculosis. Coming to the questions based on leprosy, the most important dose-dependent toxicity of dapsone is hemolysis. Mild hemolytic anemia is common, and it is a dose-related toxicity indicating oxidizing property of drug. Which fluoroquinolone is highly active against Mycobacterium leprae and is being used in alternative multi-drug therapy regimen? So the fluoroquinolone which is highly active is ofloxacin. Clinically, it is used to the largest extent. The tetracycline with highest anti-leprotic activity is minocycline. The macrolide antibiotic having clinically useful anti-leprotic activity is clarithromycin. The multi-drug therapy of leprosy is superior to monotherapy because it prevents emergence of resistance, effective in case with primary dapsone resistance, shortens the total duration of the drug therapy, so all of the above. In multi-drug therapy of leprosy, rifampicin is given monthly. It is not given daily. Which anti-leprotic drug suppresses lepra reaction and reversal reaction? That is clofazimine. The only macrolide with significant activity against M. leprae is clarithromycin. Coming to antifungal drugs, source of amphotericin B. Amphotericin B is obtained from Streptomyces nodosus. The polyid antibiotics act by, now these antibiotics, they bind to the ergosterol and create micropores in the fungal cell membrane, right? They have high affinity for the ergosterol which is present in the fungal cell membrane. The most important toxicity of amphotericin B is nephrotoxicity. Amphotericin B is not effective in the following fungal disease. It is not effective in dermatophytosis. Dermatophytosis में antifungal amphotericin B is not given. The most important toxicity of amphotericin B is nephrotoxicity, right? Indicate the antifungal antibiotic which is used intravenously for systemic mycosis. Amphotericin B is used systemically for mycosis. The drug of choice for monilial diarrhea. Monilial diarrhea के लिए the drug of choice is nystatin. Now this is the drug which is used in fungal infection. So these are some drugs which we are seeing here, which are not related to HIV. Idoxuridine. Idoxuridine is basically limited to the topical treatment of herpes simplex keratitis. The high virus selectivity of acyclovir is due to its preferential uptake by the virus infected cell, need of virus specific enzyme for conversion to active metabolite. Both these things look correct. Its action on virus directed reverse transcriptase, which does not occur in non-infected cells. So here it does not affect the virus reverse transcriptase enzyme. This statement is correct, so this is correct. Ganciclovir preferred over acyclovir in the following condition. Ganciclovir is given in cytomegalovirus retinitis. The antiviral action of amantadine is exerted through antiviral action of amantadine interaction with the viral M2 protein. The drug used to treat avian influenza is oseltamivir. Out of these drugs, oseltamivir indicated for prophylaxis as well as treatment of influenza. Indicate the drug that is used to treat chronic hepatitis B. So chronic hepatitis B में interferon and lamivudine both are used. So A and B. Resistance to zidovudine develops due to mutation at the reverse transcriptase level. That is the reason. The virus directed reverse transcriptase enzyme is inhibited by zidovudine. Select the drug that is active against both HIV and hepatitis virus, that is lamivudine. So these are some questions on antivirals, and the rationale for combining ritonavir with lopinavir is cytochrome P3A4 inhibition by ritonavir. Which drug is not a protease inhibitor? Now nelfinavir, saquinavir, abacavir and ritonavir. Abacavir is reverse transcriptase, nucleoside reverse transcriptase inhibitor. It is not a protease inhibitor. So the right answer is this one. Then the drug that binds to viral envelope glycoprotein preventing conformational changes is enfuviritide. Enfuviritide is basically the fusion inhibitor. It is the fusion inhibitor. So it inhibits the attachment of GP14, GP120 and GP14 to the virus cell. Enfuviritide is a fusion inhibitor. Enfuviritide acts on GP41. CCR5 receptor inhibitor used in the treatment of HIV is maraviroc. That is a newer congener is called as vicariviroc. ART drug considered safe during pregnancy is all of zidovudine, tenofovir, all of the above. So these are some anti-HIV drugs. select the drug malarial anti-malarial पे आते हैं. Select the drug which is a causal prophylactic for both falciparum and vivax malaria but not used as prophylactic on mass scale due to risk of severe reactions. Now here the drug is primaquine. If a drug is active against the pre-erythrocytic stage of the malarial parasite, it will be useful as a causal prophylactic. A drug that acts on the pre-erythrocytic stage is causal. Now primaquine is not used on a mass scale because of its toxic potential. This I forgot to mention. Antimalarial which is cyclized in the body is proguanil. An adult male living in non-malarious area to visit an area where malaria-resistant falciparum is prevalent. He is intolerant to mefloquine, has G6PD status is unknown. Select the drug for prophylaxis. So now since he is intolerant to mefloquine and G6PD status नहीं पता तो primaquine भी नहीं दे सकते, तो we can give doxycycline to this patient. Indicate the drug that is slow acting, low efficacy blood cyanotoxide should not be used singly as a clinical curative. Now here should not be used singly. Chloroquine, quinine, mefloquine. Here the answer is proguanil. It is used as a clinical curative, cannot be dependent upon, especially in falciparum malaria due to slow response and rapid resistance. Anti-amoebic drugs. Anti-amoebic drugs में basically we have anti-protozoals also. Anti-amoebic and anti-protozoals are here. So the following precautions to be advised to the patient while prescribing metronidazole: to avoid driving, to get leukocyte count checked, to avoid fatty food, to avoid alcohol beverages. This is the right answer because it can result in disulfiram like reaction on taking with alcohol. In addition to amoebiasis, metronidazole is used. Metronidazole is used for giardiasis. Metronidazole is least likely to be effective in the treatment of. Now, metronidazole hepatic amoebiasis में infection caused by fragilis pseudomembranous enterocolitis, but not in pneumocystis. Pneumocystis carinii pneumonia में metronidazole is not the drug of choice. In addition to having anti-amoebic activity, tinidazole inhibits anaerobic also. The following drug is used for oral treatment of trichomonas vaginalis, that is tinidazole. The drug of choice for acute necrotizing ulcerative gingivitis is metronidazole. So likewise we have many questions on the other antiprotozoals also, so please go through all of them. Coming to the last part of the antibiotics, that is antihelminthic. The most probable mechanism of action of mebendazole. Mebendazole causes loss of intracellular microtubules and inhibits the glucose uptake in the worms. Albendazole is less effective than mebendazole in the following helminthic infestation, where it is less effective in trichuriasis. The following antihelminthic acts as a cholinergic agonist in nematodes and causes spastic paralysis of the worms. This antihelminthic, that is parental pamoate, this causes spastic paralysis. The condition for which 3-day treatment with parental pamoate is recommended in place of single dose therapy is nectoriasis. A 3-day course is recommended in necatoriasis. The following antihelminthic is found safe during pregnancy, that is piperazine. Piperazine can be used in pregnancy. A child has been brought with intestinal obstruction due to clumping of roundworms. Now select the antihelminthic administered by intragastric tube can relax the ascaris and relieve the obstruction, that is piperazine. Drug causing flaccid paralysis of ascaris. It causes flaccid paralysis of ascaris. So piperazine, it is helpful in. Antihelminthic which also acts as an immunomodulator is levamisole.